whatever you do, you have to understand your audience. And there might be a few audiences you're trying to reach with a communication, right? It could be employees, it could be doctors, it could be patients living with this condition in this part of the country at this age group. You have to understand where they're living their lives. And living their lives means, how are they getting their information? How are they spending their time? Even if I'm suffering with a condition, I'm not just a patient, I'm a human. So being able to use data, analytics, and now AI tools, which are just phenomenal, to really help us pinpoint those audiences and understand more about them, that helps us be matchmakers.
JPAGs, I am so excited to have you on this episode of Business Innovators. You have been someone that I have watched and I've been able, fortunately, to see grow through the years into the position you are now within the healthcare industry as, a president within Real Chemistry, one of the top agencies in healthcare. And it's just been an amazing trajectory, and seeing you grow and just seeing you get to where you've been. And I want to welcome you to Business Innovators.
Oh, thank you so much for having me. It has been a wild ride, and I'm really pleased to be here and have this discussion. So thank you.
Cool. Well, listen, I really want to start because I think what's very important is, especially with a lot of successful people that we've had, I'm curious growing up what that was like, and if there were influences early in your life, either family members or people in the community or your community that, really gave you something that, helped you in terms of how you've become successful.
For sure. I had the pleasure of growing up as an only child in East Hanover, New Jersey. So a Jersey girl through and through. And I had a great upbringing. I had a great childhood. I was very interested and active in sports. I loved playing softball. That was the sport of, that was my favorite sport. And I played that all throughout my years growing up through high school. Wasn't good enough to play in college, but I really enjoyed it. And I think that played a really important role in my career and just how I, deal with life. We've talked about this before, how important sports are for teaching kids how to be a team player, how to deal with failure, how to, get up, wake up and go to practice every day on time and practice when it's snowing out. So I really learned a lot of great lessons. And, to the credit of my father, who was a high school biology teacher, who always made time to, to get his catcher's mitt on and go out in the driveway while I pitched to him. He'd rake the leaves. He would, whatever he had to do to make that pitching mound for me, he would do. And my mom came to all of my games. So that was fun for me. I really enjoyed it. I think that played a really important role. And I also had an early high school teacher, Joe Lanetta, and he encouraged me on the flip side of sports to pursue speeches and public speaking, which was kind of wild. That's what the dorky kids did, right? It's kind of they called it declamation, when you memorize famous speeches and then present them like you're the one giving the speeches. So
that's pretty cool.
That was wild. So that really helped me gain confidence in speaking to all different types of people and strangers. And again, gave me discipline, in a different way than sports. So I think those things taken together really helped give me confidence to, and the interest in communications and pursuing something that had a team environment.
Yeah. You talked about your mother and father, and it really sounds like you were very fortunate in the fact that they were there for you. Obviously, being an only child is a plus, but it sounds like, they really were there, and that was a major part of shaping kind of who you became eventually. Is that accurate?
No doubt. My father was a high school biology teacher, so he was very big on my studies and school, but not in a crazy way. And my mom was a working mom. She worked at Nabisco. She was in corporate America. So I got to see both of my parents balance demands of a family and me with working outside of the home. And because of their schedules, they were able to give me a lot of attention and also a lot of leeway. I was an only child growing up in the 90s, latchkey kids. So I think that also teaches you, independence. And they really cultivated that in me, which I'm very appreciative for.
Definitely. And I also want to talk about team sports. I have two teenage daughters, and I am so grateful that they are playing. I really never thought, like, if I look back 5-6 years, that they would have been interested, even because they never showed that. And I can just see the difference in them. They're playing lacrosse now, and in the fall they play soccer. But I could just see, like you talked about, what that really does, especially for their confidence and in the world we are in now, and both being females and just having those friendships, it really, I have noticed what it's done for them. Can you just elaborate on a little bit more? Because I do think it's so, so important.
I'm so glad that they're involved in sports. And I think, in our day and age where your daughters are probably tied to social media and their phones, pretty much all the time, I feel sports and anything in real life like that becomes even more important and has an even outsized impact on you. It really does teach you discipline. It teaches you how to, you're going to lose a game. That happens. You're going to, I was a pitcher. I mean, sometimes I won the game because I struck someone out, and sometimes I freaking lost the game, or I felt like I did because someone hit a home run off of me. So, it teaches you how to deal with loss and winning and how to keep things into perspective. It helps you figure out what your strengths are. You're not going to be good in every position. How do you lean on other people who are better, right? That's going to serve you well in life. And it teaches you how to communicate, right? You're communicating in many ways, not just what you're saying to your teammate on the field, but in how you handle yourself, how you show up at practice. Are you giving it 100%? Are you half-assing it, right? And I think those are just tremendous, tremendous skills. And for women, for girls, confidence, strength, certainly, and being active. And these skills now are going to serve them so, so well in the future. And in fact, when I look at hiring in my role, and I'm a communicator, I will pick and hire a college or high school athlete 9 times out of 10 if they're checking other boxes, because I know they are going to bring a different level of discipline, focus, camaraderie. They get it. I don't have to teach that skill. It's just innate. So there's so many benefits to sports, and I'm so glad that they're part of that. I certainly benefited from that and still do today.
I know sports has played a part of this, and, I can tell, even quick interview, talking to you, you are an incredible communicator. What else besides sports, and what other things is it innate? Is it natural that really play into that? Because I really do feel like when, knowing you and knowing how you're able to communicate with so many different people, so many different worlds, but really just, to me, it seems like a superpower.
Well, thank you. It didn't always come naturally, that's for sure. But I realized throughout my career that, you can have the basic, you can learn how to write a spreadsheet. You can learn how to balance a budget. Someone can teach you these technical skills, right? No matter what career you may pursue. But what is not always taught is how to persuade people, how to, get them to try to go to the same outcome together, even if you're coming at it from different directions. And I think that comes with having humility. I do not know all the answers at all. So I try to ask a lot of good questions. I try to lean on the strengths of others. We talk a lot at my company about having the bat phone, the phone a friend. Who's on your phone a friend list? Who the heck are you reaching out to when you don't know something? Or are you a know-it-all and you know everything and you're just going to learn it on your own? That's not going to work. So I think I realized that you can get further together with other people who are humble, who have no ego. And if you can seek those people out and assume positive intent, and that's something a mentor of mine, Jennifer Gottlieb, talks about all the time, assuming positive intent. No one's out there thinking about me. They're thinking about themselves. No one's out there to give me angst or agita. No, we want to solve something together. Let's assume positive intent and go that way. So again, these lessons, you learn them through trial and error. You see and observe what you don't want to do. In terms of communicating, I had some not so great managers and growing up, and I think that I learned from them as well. We all should, right? How do I not want to manage people? What's the opposite? That's the opposite of what I want to do, and you follow people that tend to have the same, kind of interests, but also they're having impact. And you take little things and little tips and tricks from different people, and then you form it into your own leadership style. So I've been very lucky to be able to do that. And I've been surrounded by a ton of really smart, caring people. And in my industry, which is healthcare, we're not selling sneakers. We're trying to help people be healthier. We're trying to help them live longer. So if you have the same kind of mission with your colleagues, and I'm very lucky that I do, it becomes a heck of a lot easier to find common ground and march towards a common goal.
I love the fact, and now as getting older and understanding and realizing how important healthcare is, and just seeing within our country and within the world, just different diseases and just how important it is. I want to get into how you got started and how you've stayed and how you've grown within that industry. But I first have to get to your college experience, because you went to the school that if I could go back and do it again, 1,000%, I would have loved to go there. And that is Penn State, because Big Ten, I know that, I see you drinking from the Penn State Cup. Yeah,
yes,
there we go.
Yeah,
I mean, I want that. I went to Boston University. There's like no school spirit. Tell me about your experience at Penn State and your experience there. How did that play into your career once you did graduate? I assume you graduated.
I sure did. I did graduate, though I have nightmares to this day that maybe I didn't. I didn't quite pass that French course, so maybe this is all a farce. But I was so lucky in high school to have a teacher, Mrs. Wiggin, who, when I was starting to look at colleges, I had no idea. We didn't talk about college when I was growing up. It wasn't really a thing. It was understood that I would go, but even though my dad was a high school teacher, we didn't really talk about it. So I was open to all suggestions. And luckily, Mrs. Wiggins said, listen, she did call me Jen. She did not call me JPEG. She said, listen, Jen.
Oh, yeah.
And JPEG is my softball nickname. So that's how that all came together. But anyway, she said, Jen, you might want to think about Penn State. I'm an alumni. I think you would really thrive at a larger school where you can have every experience and opportunity to specialize, learn things, try things, and meet different people, versus going to a smaller school, and going that route. So I said, all right, let's check it out. I checked it out. The second I stepped out of that car, when my parents drove me to Happy Valley, I said, this is the place for me. It checked every box. It was big. There was a lot of school spirit, to your point. I loved sports. I sure as heck wasn't good enough to play D1 college softball, but I wanted to go to the football games. I wanted to have the school spirit. I wanted to get involved in everything I could get my hands on, and I wanted to have fun. I was very lucky that, I didn't have to work while I was at college. I could focus on my studies, but when I came home, I would be a waitress and save money that way. But I was able to work hard and study hard, and I did. That was my job. My parents worked really hard to send me there, and I was so lucky, and I didn't want to squander that. But I had a lot of fun too. I met a lot of different people and friends that I am still friends with and on text chains with to this day. And I just look back on that experience as nothing but positive. And I even was able to, when I was a junior, I got invited to be part of the honors the honors college, which was new at the time. And first I was like, I don't want to do that. That seems like so much work. But I said, why not? They offer study abroad. Studying abroad was very appealing to me. So again, like I was taking chances and going to places that I knew I would have a lot of options if I wanted to pursue those things. So I studied abroad in London. I met a tremendous network of friends and professors, and it was just great. And I think that network and that community, to this day, I lean on that. And I wouldn't have gotten that maybe at a smaller school. I was able to really get it there. So we are Penn State all the way. Love it.
Well, if I ever go back to school, I'm going to Penn State. I'm applying. I might need
I might be able to write you a letter of recommendation. I'm an alumni, so I'm good standing.
Hope you can get me in. Let's talk about healthcare.
Yep.
This is where you really have made your mark, your career. We mentioned it. You mentioned it earlier, just how important it is. Just I've seen, or I don't know, as I said, if getting older or it's just what's happened, or happening now in life in terms of, different diseases and issues, but it's such the most important, without a doubt, field I could imagine. What was it that drew you to it, and how did you initially get involved?
I had no idea. I graduated with a degree in communications. I knew I wanted to be in public relations, whatever I thought that meant at the time. I had no idea, though, that healthcare communications was even a thing. I was young. I'm not even thinking of my health, right? You're thinking of fashion, culture, celebrities, whatever you think about when you're younger. So I fell into it. It just so happened to be that was the job my agency opportunity was in. It was in the healthcare practice. So I said, okay, I guess I'll learn about this. And thank God I did, because once I really started to understand how healthcare is the great equalizer, it impacts every single one of us. Whether you're dealing with a chronic condition yourself, you have a loved one who you've lost to some disease, a cancer or something else, or, it's around us all the time. So I felt like that was really appealing to me. I also liked the fact that it's always changing. In healthcare, a lot of what I do is help companies communicate about science, about new medicines that are cutting edge, that are being approved by regulators, for all sorts of diseases and conditions. And I liked that idea that it was always changing. There was always more to do. And, that there's a need. People don't understand healthcare. Our healthcare system in this country sucks. It's not easy to navigate. It's not easy to navigate if you are a healthcare provider, never mind a layperson, right? Like our parents. It's very, very difficult. So I also felt in some small way, I am helping someone when they need it the most, find the right information so they can have an informed conversation with their doctor to make decisions that will positively impact their life and that of their family, what greater calling, right? We say all the time, at Real Chemistry, where I work, we're a healthcare marketing and communications agency. We don't make the medicine, right? But we make everything around it, right? We help convey information. We help educate. We help identify the right trusted voices that are going to relay information. We help clients navigate this crazy world today that is our healthcare system. And every day it seems we wake up with a new issue, a new crisis, and clients come to us because they need help navigating the environment, but also getting their medicines to people that need them, because that's why they develop them. So it's just been interesting. It's been challenging. There's no day, I wake up every day and it's different. You read the headlines, all of us can see that. So it's needed now more than ever. And clearly communications is just so central to it. So I'm really proud to be in this field.
No, well, absolutely, because without the communications and obviously within this field and just being a science and if you can't communicate it or understand it down to the level of most typical human beings, you know, then they're never going to get that information, or they might not have that opportunity to say, hey, maybe this, you know, is a good drug for me, or I
Yeah,
should
or
talk.
maybe I have to talk, gosh, something hurts. I'm noticing something. Maybe I have to go get tested or screened
Right.
to see if I'm sick. Just
Right.
encouraging people to do that is a big part of what we do. And, there are lots of underserved groups in this country where access to medicine and quite frankly, access to information is limited. So how do we work to help our clients even that playing field? And that's very difficult. That's very difficult to do. So, and we saw during COVID that impact is real. So I think the time we're at right now, it's not COVID, but it does remind me of that. The swirl, the drama, the questioning of science and medicine. It's really, in one sense, it's a little scary, but we can't get overwhelmed by that because we can only help clients do what they can do. We have to stay focused. So that's what gets me up out of bed every day.
How have you seen that change? Obviously, since you began and started, and social media now, and anyone can go on. And now, I mean, AI, where it's just completely realistic. You have no idea. People can say anything. They get their information from there. How much harder has that made, especially what you do with healthcare communications and getting the real message out there?
It's a great question because it has gotten more challenging. I'll take the media part as an example. My subspecialty within healthcare is media relations. So that means my team and I have 60 dedicated healthcare media storytellers on my team. They're so talented and excellent. Our jobs in the simplest form is to work with reporters and other influencers covering news in healthcare on behalf of our clients. And my clients are big pharma companies, biotech companies, public health organizations, you name it, runs the gamut, hospital systems, etc. So the media landscape is so different today than it was even 5 years ago. Never mind when I started my career 20 plus years ago. It used to be that you would, contact reporters at the New York Times, Wall Street Journal, USA Today, the end, right? And work on those stories. Now, those outlets are part of the health media ecosystem. Certainly, they're not going away, but we're seeing this rise in influencers. In anyone can be a journalist, right? In today's day and age on social media, the channels are more diverse in terms of where we get our news. I'm sure you wake up in the morning, if you're anything like me, the first place I go for information and news are my social media feeds, right? I'm on Instagram, I'm on Facebook, I'm on X. What's going on in the world, right? I'm not waking up and finding the hard copy of the New York Times, reading
And
that.
it's
I'm
so
not. No,
crazy, right?
not
It's
a lot of
like,
people are anymore.
no.
It's still important. So anyway, you have to have a much broader understanding of the media influence ecosystem. And that's where data and analytics, which has also come a long way, is so mission critical to how we tell stories and where. Because whatever you do, you have to understand your audience. Okay. And there might be a few audiences you're trying to reach with a communication, right? It could be employees. It could be doctors. It could be patients living with this condition in this part of the country at this age group. You have to understand where they're living their lives. And living their lives means, how are they getting their information? How are they spending their time? We're not just, even if I'm suffering with a condition, I'm not just a patient, I'm a human. So being able to use data, analytics, and now AI tools, which are just phenomenal, to really help us pinpoint those audiences and understand more about them, that helps us be matchmakers. That helps us match our communication, what we're going to say, to them in the right channel. And that's a real, that there's a lot of opportunity, right, to do that. And it becomes even more critical for companies with the rise of disinformation and misinformation. working with journalists who abide by certain standards is never going away. That will continue to be critical. But you've got to expand the net of the people with whom you're engaging, right? Bloggers, podcasters, influencers. And so I spend a lot of time, my team and I, educating our clients who are in a highly regulated industry, how to do that compliantly and what the benefits are of doing that and the risks of not engaging and getting your messages out to people. Because if really what we're trying to do in healthcare is make people better, improve outcomes, you've got to be where they are. You can't ignore 50% of the country because maybe you don't agree with a podcaster's political stance. You can't, that's not what we're here to do. We're here to serve. So that's a really fun challenge. And again, thank God I work at an organization that invested so early in data and analytics and now AI tools to help us understand and provide the best counsel to our clients who are navigating a whole slew of different issues.
Yeah, it's so funny because I think it was last weekend, I was walking down the street, live in New York City, and, all of the little newsstands, a guy went up to the newsstand and was like, "Do you have the newspaper?" And there's a newsstand. And he didn't have any hard copies of any of the newspapers. And that was kind of like my moment when I was like, holy shit, like,
Yep.
This is like...
It's a different world.
You're in a different world.
It's a different world.
You mentioned data, analytics, influencers, and also how do you deal with it's just individuals who post their stories on Instagram or post and throw out, I guess, statistics and data and maybe misinformation, maybe the right information. It seems to me within your position, that's got to be so difficult just to, obviously to monitor and influencers have bigger crowds and networks, but still just, you have to kind of get out the analytics and data to everyone.
Yes.
Like.
It can be overwhelming if you think about it like that, like, oh my God, we got to put out all these fires, all these people that are putting out misinformation. That's not how we think about it, because if you did that, that's all you would do 24 hours a day. And fun fact, you wouldn't even be able to get to everything, right? Because some of this misinformation is AI generated. Okay. So that's where the data comes in, because it's giving us predictive modeling and the ability to see who actually has influence and with whom. That helps companies and us say, gosh, where are our efforts best? Where should we focus? Okay. Is this person who's putting this out, do they have a following of 3? Okay. Let that go. Oh no, they've got a following of 1,000 people and those are all MAGA influencers because they're connected in other ways. Okay, let's think about that. How do we get the right information to them, correct it, issue something different? But, so the data does help us do that. It's also important to play offense on communications. We are no longer, in our world of fact checking is going down. These companies, social media is not fact checking anymore. The onus is on companies to do that themselves. So again, knowing where to fact check is critical. A third point is when we talk influencers, you might just automatically think celebrities that are living with a health condition or something, and they play a very important role. And we have great expertise in finding the right folks for certain campaigns. But influencers can also mean physician influencers or physician social media influencers, okay? So they become reporters in a sense. They're the ones. I just spoke with Josh Burvell at South by Southwest. He's he's a new doctor. He's a young guy, and his mission is to myth bust medicine. That's his whole mission. So partnering with someone like him, whose mission it is to get the facts out there about certain conditions and dispel, inaccuracies, that becomes really important. And the smart organizations are doing that. They're not just working with doctors that are publishing research. That's important, but they're also partnering and educating social media influencers who have the same shared values and mission to get the right information out there. And I think you're going to continue to see the importance of that in shaping what's put out.
You mentioned AI. We have to talk about AI. How have you noticed, we're at the beginning, right? And you already see just how quickly it's moving and how things have changed in almost every industry. Within healthcare, what do you see, or how do you see the involvement or evolution of AI in terms of just how it is going to affect healthcare?
I think AI is changing our world, no doubt. It's like the beginning of the World Wide Web. We're going to look back on this time and say, wow, this is when the world changed. In healthcare, I don't think we're there yet. The hope is that AI, as it becomes smarter, as these tools become better connected to health records and healthcare systems, et cetera, can help us hopefully one day predict perhaps who will benefit from a certain medicine, who will benefit from this type of approach. Or can companies use AI to say, gosh, this medicine that's been sitting on the shelf at a pharmaceutical company, getting dust on it, they haven't been pursuing it. Gosh, how can we predictively test it in this condition because we know all of these things? So, I mean, the potential for AI to discover and develop drugs faster is going to be real. Is it real today? No. The ability of AI to help with diagnostic testing, who should be tested when, and how can we decrease the time from diagnosis to a treatment? That's gonna be a thing. How can we make the patient experience better with AI? I was just talking to a friend who is the care partner for his parents. And he said, gosh, I have to make all these appointments. I have got to take notes. I've got to keep it all. It's too much. Why can't there be an AI assistant for me to help my parents? You're right. And thank goodness companies are looking into just that, which I think is phenomenal. And from a communications perspective, AI is helping us research things faster. It's helping us digest big quantities of information more quickly. So when I have to become smart about a certain type of cancer, so I can talk to a reporter, it's really helpful. But what it's also showing me is that the value of communication skills will remain not only as important as it is today, more important tomorrow. So for your daughters, for kids that are in college, and I talk to a lot of them are fresh out of school, I say, guys, you were born digital. You need to keep learning, growing, and understand the technology. We all do. But you've got to dedicate the same amount of time and energy to how you communicate, written, social, verbally, because those are the people that are going to stand out in any industry. It doesn't matter what you are, what you're in.
No, it's so true. It's advice I tell my kids all the time right now. All I would be focusing on is AI, how AI is going to affect, just the world, and what, they look at me like I have like three heads and, don't listen, but they will, and they're going to understand. And you just said it, like they're digital first, and this is just the world they're in right now. It's so different from when, let's say, we started our careers. And, I do want to ask you, because you've been successful as a female, risen through the ranks, of your of your field, and now within real chemistry, which for many people is like, or many people don't know, is like the top healthcare communications company in the world, right? Whenever I see those rankings, I always think of you, because real chemistry is always like one or two,
Absolutely. We just won a couple of weeks ago, PR Week's Healthcare Agency of the Year. And that's just one of many awards we're so lucky to.
You're all the time. I see real chemistry. But what would you say, if someone is coming out of school right now, graduating Penn State, wanting to get into healthcare, how would you have them look at it in terms of going for, it seems to me like there'd be so many different angles you could approach nowadays as opposed to maybe 20 years ago. But What advice would you give someone who is looking to get into the field?
Oh my gosh. Number one, I would say we need you. We need you. We need more smart, motivated individuals to get into this field because we have an aging population. But then, it's younger people. We need people with a younger headset to keep us relevant and to make sure that we're continuing to communicate in the right ways. I would say, think about what you are good at and what your interests are, because 9 times out of 10, there will probably be, and if you're passionate about healthcare, you may not be. You may say, okay, no, I want to go work for a company that's selling sneakers. No problem. That's great. To each his own. But in healthcare, there are so many ways at an agency like ours that you can get involved, right? Maybe you have a real analytics background. We have hundreds of analysts that work at our company. They help us communicators be smart and informed. Maybe you're really interested in data, in imagery and AI creating incredible videos and content. That is rising. Maybe you're really interested in social media and you're excellent at that. Gosh, we need that. We need that headset more than ever, right? In terms of activation and the like. And that's the beauty of an agency. You're going to be able, whether you're at an agency that only focuses on healthcare, like Real Chemistry, or a different one, you're going to have you're going to be able to see that there's a lot of different ways to use your skills based on your interests. Healthcare is a recession-proof industry. Full stop. You will always have a job if you are effective, curious, and a good partner. So, gosh, if you're interested, I'd be happy to talk to anyone who's interested in considering a role in the field. There's plenty to go around. Even advertising, healthcare advertising. We own a company called 21 Grams. They are the best healthcare advertisers, and I learned so much from them. We need creative individuals. I mean, you name it. Whatever your superpower is, chances are there could be a role for you at an agency, whether it's communications, analytics, social media, you name it.
Yeah, it's funny because, some people are just don't understand or don't realize, you're coming out of school and you don't have obviously the knowledge you have, and you think, oh, healthcare, like I've got to love, researching diseases
Funny story, Robert. It's so true. 'Cause that's what you would think. Oh, okay. You think healthcare, you think scientist, you think doctor. And I don't know about you, but I didn't go to school for any of those things. The science class I had to take at Penn State just to check the box was called Rocks for Jocks. That was the nickname of it. So imagine my high school biology teacher father, I got an A in Rocks for Jocks, great. But most communicators do not go to school because they have some passion for science and all the things. You go because that's of interest to you, or you know what you're not good at. But to be able to parlay your skills as a communicator it's needed in healthcare because we're translators. We're translators. So it's almost good. It's almost better that I'm not a scientist and I don't get it, because I've got to help that scientist who's doing the hard work of developing a medicine relay what this could mean to a lay audience. So in that way, it becomes a strength in a sense. But yeah, who would have thought, from Rocks for Jocks to Real Chemistry, and there's no stopping now. So.
Well, that's what I love about you, because you're so humble, and humility that you have, and talking about, taking classes like that in Penn State. And as I said, you're very humble, but there's a reason you have been able to rise to where you are. And it's obvious to me, at least, aside from hard work and effort, but being able, like you said, to communicate, and you even in this conversation, pointing out so many times, not you, but your team, the people I've seen who've the best leaders from doing 350 of these podcast interviews have been the ones that are always giving credit, to their team and others. And it really seems like, with you, it's really empathetic. You feel it. And I could imagine that, you would admit or say, because you will, that without that, without these folks, without, everyone, you talked about your mentor early on, you wouldn't be where you are.
No way. There's no way I would. And our founder, Real Chemistry's founder, Jim Weiss, says it best. He says, better together. It's true. You could go so much further together. That's it. And again, I think that harkens back to being in sports and being part of a team, and realizing you're not going to be the best at every position. That's it. And so if you can let that ego go and you can welcome other people in, you're going to get to that outcome you want faster. And fun fact, it's going to be a lot more fun along the way. And we have a lot of fun too, because, healthcare is not for the faint of heart. It's hard. Science is hard. Medicine is hard. Our healthcare system sucks. So on paper, those are kind of negative. So we need people that are going to work together to solve some of these issues. It sure as heck not going to be one person like me. We need all of us together to make it happen. So another one of Jim's favorite quotes: "Make it happen. Just do it, and join an organization where you see opportunities to grow, try new things, and become just always evolve in your career." I would never leave Real Chemistry. I'm learning something every day. There's always something new we're trying. So that's great. But if you fall into a company where you're either the smartest person in the room or you're just bored, get the heck out of there fast. Do it. Leave, because you're going to be stagnant. You're not going to be marketable, and life is too short. You should have fun. You should be challenged, and you should be trying to, improve the world in some small way. So,
no, JPEGs. Before I let you go, I want to just ask you a couple more questions, and then I promise I will let you go. For you and for what you're looking at, or what we're all looking at in terms of healthcare, I know this is a little bit of a difficult question, but where do you see, the growth, or where do you see healthcare in terms of how things might shape in this country with everything we talked about, our healthcare system? Can you envision what that might look like 5-10 years down the road? Is it even possible?
Yeah, I mean, what I hope the future holds is a better, more seamless experience for a patient or a caregiver navigating the system, being able to see a doctor, being able to get screened for a condition that might run in the family. I'm hopeful that will improve, but that's going to take all of us. That's going to take industry, like the pharmaceutical companies. That's going to take advocacy, the American Cancer Societies of the world. That's going to take, the government. It's going to take everyone together, and celebrities and others, to elevate these issues so we can fix them. It's not going to be easy, but I'm hopeful. I'm also hopeful that medicine, as it's advancing, is becoming more and more personalized. The more we understand about biology, the more we understand about the human genome, the more these advances in medicines are, they're going to be matched to the right person. And we're seeing that in cancer now. We're seeing that in so many fields. So that I'm very hopeful for that. I'm also hopeful because so many companies are spending a lot of money and energy on this, that we are going to be able to improve chronic conditions like heart disease, cardiovascular, kidney. I mean, there's so many chronic diseases that we thought we had. Oh yeah, we got those. Those are okay. Those are manageable. You know what? They're not. And thank goodness that there are companies that are continuing to innovate, continuing to spend the money and invest to find solutions. That brings me great hope. I have the pleasure of talking to scientists and executives from the pharmaceutical field every day. And while the industry sometimes gets a bad rap, I am so reassured that there are smart, brilliant, passionate people that are trying to make the world a healthier place. They are.
It's great to
and
hear.
It's hard. And failure, you fail more than you win in health and medicine.
Yeah.
And thank goodness we have really bold, brave people in it to keep pushing us forward. So, gosh, let's check in a couple of years. I think even in a couple of years, it's going to change. So, where AI is not just a buzzword. AI is not going to be just a buzzword in healthcare in a couple of years. It's going to be more tangible. So I'm looking forward to that as well.
Okay. Last question before I let you go.
Yeah.
What, healthcare, as we talked about, the industry, so important. Was there a moment overall just where you did something or involved in something that, just made you feel really good? I sell podcasts, right? I
Yep.
create
Yep.
okay,
Absolutely.
there's not like that moment,
Yeah.
but you might get people saving lives, or was
Yep.
there anything specifically you recall or you remember where you were just like, it was better than any, bonus or promotion, or just, real stories, real people, real incidents?
Absolutely. Certainly navigating the years of COVID was so exhausting, yet fulfilling in every way. Every day was different. I don't think I left my desk for, a few years, and I wasn't even developing vaccines or anything. I was just trying to help. We were just trying to help our clients, help the world really. So, but what I love most about my job is when our team and I would get to tell patient stories. Real people's experiences, benefiting from a medicine, being part of a clinical trial, or something of the like. Because I tell my clients all the time, I say a press release is not going to drive impact. If you're trying to reach a patient or a care partner, they're not going to read that. They're not going to read corporate jargon and do anything. But when you can find and uncover a really heart-wrenching or just inspiring patient story, that is everything. And so I had the honor of working with a company called CRISPR Therapeutics as they were developing the very first FDA-approved CRISPR-based medicine for two conditions, sickle cell and beta thalassemia. And as part of that journey with them, it was based on Nobel-winning science. We were able to help a patient, Victoria Gray, who was the first woman in America to be part of that trial, a first ever trial. She suffered with this condition for her whole life. It kept her tethered to her home. She couldn't even go see her kids play basketball or travel because she might have a crisis, a sickle cell pain crisis. And she had the guts to be part of this first trial for this completely new approach. And we worked with an outlet at the time, it was NPR, to chronicle her experience before, during, and now after treatment. And she's been in remission and cured, quite frankly, because of this medicine, this one-time treatment. That to me, and seeing how her life changed, 180, it is just so fulfilling. There are so many stories of Victoria Gray out there, maybe not for conditions that serious, but and listen, we can all be inspired by that. People are finding her story and then talking to their doctors. They're having a different conversation and they're bringing the article. So again, that patient storytelling, even though it might be, take different forms on different channels, a TikTok post, a Instagram post, or even a radio or television segment, those get out there to the right people. And you want to hear other people's experiences before you take action. So that was a very proud moment of mine and many other people who helped tell her story.
Well, JPags, you are inspiring yourself, and really appreciate coming on Business Innovators. There's no doubt, I think everyone can see why you have become who you've become in this industry, and just the energy you have and love and just sharing that story. It's got to feel so good. But I want to thank you again for coming on today and talking about your life and healthcare, and keep doing what you're doing, because it's so important.
Thank you so much for having me. This is a great discussion. Happy to talk to any of your listeners if they want to kick the tires on healthcare challenges or learn more about the field. It's exciting. It never changes. It always changes, rather. And, we need more smart, focused, dedicated people who are as passionate as I am about the space. So hit me up on LinkedIn.
Well, you just stay in it for a little bit longer. We need you.
Yep. You got it. You got it. Thank you very, very much.
All right, Jay, thanks.